That's okay.
Let's go.
Good afternoon. We hope everyone is keeping safe during the COVID break. We welcome you all for our third web series that Dermapen World is doing along with our Dr. Andrew Christie, Clinical Director, Dermapen World. It's great to have all of you back today. Our topic for today is hybrid mesotherapy and microneedling with DP Dermaceuticals and Dermapen 4. Please feel free to ask the questions alongside the webinar to make it more interactive, and we'll try to accommodate almost all the questions. Would like to again invite Dr. Andrew to take us through today's topic. Over to Andrew.
Good afternoon, everyone, and welcome live from my actual lounge room here in Paris. For those of you who have joined us for the previous sessions, welcome back. And for those of you who are joining for the first time, it is a pleasure to have you here. The format of Dermapen World Live to Your Lounge sessions is to deliver in an informal setting casual information that explores all things Dermapen World, DP Dermaceuticals, Dermapen 4, exploring combination therapies, indications, and also protocols step by step to now create an overall understanding of what we can deliver to our patients. I'm Dr. Andrew Christie, but we would love to hear from you for social media. So for Facebook, it's Dermapen World India. And you can also find the Australian-based Dermapen World all in one word. And of course, you can locate me for Andrew R. Christie. For Instagram, it is Dermapen_India, Dermapen World, and then myself is Dr. Andrew R. Christie, all in one word. And we look forward to hearing from you, but also through questions and answers throughout today's session to find out what you want to know, where you would like to go, and of course your success stories with all things Dermapen. With the questions that you have, because we will be catching up each week, same bat time, same bat channel every Tuesday, for questions which relate in today's topic, we have a team of moderators behind the scene who will then take those questions, and if it relates into today's topic, that will be answered as part of today's mini session. However, if the question you have is going to link into a topic we've got coming up, we will in fact answer it then. Alternatively, the team from Dermapen World India will be able to make direct contact with you for any questions which is just outside of the realm of what we cover today. This, of course, just means that we will keep to time, we will keep to topic, and we will be able to deliver pinpoint precision information, just as Dermapen 4 delivers pinpoint precision when it comes to your patients' indications and their aesthetic success stories. So today's topic is a hybrid of mesotherapy plus microneedling, and we're exploring DP Dermaceuticals plus Dermapen 4. So as we develop in with this topic, really, we need to define a couple of these terminologies. What exactly is mesotherapy? Mesotherapy's largest market is actually here in Europe, and it was developed in France in the mid-1950s, and it's the process of small micro injections to deliver biomimetic or active ingredients which the skin utilizes and recognizes naturally into the skin to promote better skin functionality, better skin quality, and better integrity. This then led into the development of procedures such as microneedling in the 1990s, but then also developments, particularly within the filler market and PRP, to now promote an overall topic of what we call regenerative medicine. So mesotherapy traditionally is with injection. So when we consider a larger area, such as the face, it may require anywhere from 200, 400, 600 injections for a full face. Then for the neck and chest, anywhere up to 1,000. There's always the challenges when anything involves an injection that there is risk of bruising, particularly around the periorbital area, but then of course there's always discomfort. You can imagine that distribution via so many injections is going to be a time-consuming process itself. So let's look at the other end of the spectrum, and why do you want microneedling? You want microneedling and you want Dermapen 4 because, first off, this activates your body's own regenerative healing and repair response. So the fractional microchannels are delivered by Dermapen 4 with absolutely no heat and with absolutely no ablation. So it therefore means that Dermapen 4 is suitable for 100% of Fitzpatrick skin types, but also 100% of ethnicities with no risk of post-inflammatory hyperpigmentation and no risk of activating profibrotic growth factors or your precursors to scar tissue. However, when we look at the physical microchannels which are delivered, particularly via a Dermapen 4 device, at full speed, it's oscillating at an unprecedented 120 revolutions per second into the skin. This means that with 16 33 needle cartridges, it means that we are able to deliver an unparalleled 1,920 puncture channels per second into the skin. There's two ways of looking at this. First, the physical solid needle, it's 16 33 gauge needles, delivering 1,920 puncture channels per second, now activates an autologous but fractional wound healing response. This in turn sees the classics of inflammation, which delivers phagocytosis for pathogen removal within the skin, but now also promotes the release of regulatory growth factors, particularly epidermal growth factor for epidermal quality, for epidermal function, keratinocyte growth factor for regulation of desquamation and for replacement and cleanness of the skin. We also look at the role of melanocyte growth factor for balance of the melanogenesis process. What Dermapen also activates is transforming growth factors, the general managers of all dermis and hypodermis functions and chemical cascades, the release of fibroblast growth factor for regulated collagen, but also vascular endothelial and platelet-derived growth factors. So we see that Dermapen is the original autologous regenerative medicine procedure working with your own process of healing, repair, and correction to now promote better quality skin, better integrity, and functionality. What we also get from the needles, particularly in deeper treatments where pinpoint blood is being performed, is the mechanical breakdown of existing scar tissue or fibrous deposits, but also regulated scarless collagen production in addition to angiogenesis, so the growth and development of new capillaries. So when I look at our modalities, mesotherapy, you have a biomimetic active, something that is a complex of ingredients which the skin makes and uses already and recognizes, that enables placement through the skin's barrier function into the skin to now facilitate better health, better quality, and better functioning of the skin. And then we have Dermapen 4 microneedling, which will now facilitate autologous regeneration of regulatory growth factors, mechanical breakdown of existing fibrous or scar tissue to now promote regulated collagen production and to redensify the skin, but then also controlled angiogenesis. With nearly 2,000 puncture channels per second, combining Dermapen in with mesotherapy, and this bottle here is part of the new MG collection from DP Dermaceuticals, which features 5 milliliters of sterile mesotherapy, which can be applied topically through this simple nipple lid, or can be dispensed into a Luer lock syringe for traditional mesotherapy technique and combination therapy with Dermapen. So combining the two together, we now see Dermapen as not just an activator of autologous repair, but we also see the fractional microchannels, 1,920 per second, facilitating delivery and administration of the mesotherapy agent without use of the traditional syringe. This now therefore means that there is no risk of bruising, there's no track marks, there's no grazing, and there's no flaking of the skin following a dermapen procedure. It now means that the downtime for mesotherapy combination therapies is just 36 to 48 hours, demonstrating a mild to a moderate sunburn in appearance and sensation for just this very short time period. So again, you will never see bruising, you will never see scabbing, you will never see grazing, and you will never see track marks. So as such, the combination of DP Dermaceuticals, mesotherapy, plus Dermapen 4 now combine the best of mesotherapy and the best of microneedling to deliver the most enhanced results. When we look at the challenges of infusion of active substances into the skin, despite what the television tells us, and despite what we commonly read in magazines or see on social media or see presented by vloggers, if we were to ask the average patient about human skin and ask them about its effect with moisturizer, with serum, the average patient believes that anything you put on the skin surface is miraculously going to absorb to the lower layers. Let's consider terminology such as deep cleansing. Let's also consider where we hear that a product has penetrated so deeply into the skin that it's just disappeared into the skin. Well, where did it go? Is it in reticular dermis? Is it in hypodermis? Likewise, we hear about products absorbing to now nurture on a cellular level. Well, stratum corneum contains corneocytes, which are cells too. So are we talking a cellular level up here, or are we talking a cellular level deeper down within the skin? So we see that marketing plays with claims, plays with misinformation, and now influences negatively the average patient and consumer who believes that this human skin is a sponge and anything you put on over the top is somehow miraculously going to absorb into the lower layers. It doesn't work that way. The reason why is let's assess the role of barrier function, otherwise known as the acid mantle. Barrier function is a water in oil emulsion which sits on the skin's surface and is designed to fortify, designed to keep an acidic environment which balances any bacterial proliferation, which is designed to prevent transepidermal water loss or evaporation, but also physically prevents pathogens out in the air or any product under normal circumstances that's applied onto the skin surface from penetrating through the barrier function or in the lower layers. Assessing barrier function, as I stated, it's a water in oil emulsion. Let's talk about the lipid phase. The lipid phase features sebum. Sebum is produced by a cell called a sebocyte found in the sebaceous gland. Sebum comprises of 57% triglycerides. This is a base oil, so olive oil, peanut oil, these are all chemical examples of a triglyceride. Sebum also features 25% wax esters. So a wax is still a lipid, but it's just not chemically an oil. Sebum also contains 15% squalane, another lipid, and then we have 2% cholesterol esters and 1% cholesterol. So this recipe is what physically constitutes sebum and its production by the sebocyte. We also take into consideration that the sebaceous gland also produces vitamin E as an oil-soluble antioxidant lipid. What we also see in granulosum layer of the epidermis is the degradation of what is referred to as a lamellar granule, or the other term for this is called a keratinosome. This is different to a keratinocyte, of course, but the breakdown of the lamellar granule or keratinosome sees the release of ceramides and the release of free fatty acids. So simply, the lipid component of our skin's barrier function features sebum, 57% triglycerides, 25% wax esters, 15% squalane, 2% cholesterol esters, 1% cholesterol, plus vitamin E, plus ceramides, plus free fatty acids. The next stage of barrier function is called natural moisture factor. And this is unique because you would think that it's water, but in fact it's water activators, not water itself. So I want you to imagine something like jelly crystals. Jelly crystals are able to bind, draw, and hold onto water, but you've got to add water so that they can reach their potential. Our natural moisture factor features some 40 to 42% of free amino acids, and these break down from proteins. These also break down from peptides within the skin, and these serve as potent water binders. There's some 20 to 22% of mineral salts and sugars, similarly to electrolytes, with our classics being calcium, magnesium, potassium, and of course, sodium. We see the role of glycerin, about 15% of hyaluronic acid, the role of pyroglutamic acids such as zinc PCA or sodium PCA, but then we also see added into this equation lactic acid, urocanic acid, and urea. So quite simply, the combination of these free natural moisture factor agents, simply add water, like jelly crystals, it activates them. So we have our water phase. This then becomes emulsified into our lipid phase, sebum, ceramides, free fatty acids, and vitamin E, via the 2% cholesterol esters and 1% cholesterol, which is found in sebum. This then binds so that our skin's barrier function is a natural water in oil emulsion to protect the skin's surface layer, but it prevents infusion and absorption of most topical agents applied onto the skin. So we understand that under normal circumstances, skin is not a sponge, but we also understand with traditional techniques, particularly for mesotherapy, it's time consuming. The risk of bruising becomes almost guaranteed, particularly around the periorbital ring. And we also understand that there is extended downtime, whether that is bruising or whether that's an increase of erythema. So can Dermapen microneedling serve as an effective facilitator, and can it now create the ultimate combination therapies to deliver mesotherapy, but to also activate the same autologous regenerative corrective response, releasing your own growth factors, activating angiogenesis and collagen deposition as well. The innovation of Dermapen 4 for this procedure is that the needle cartridge contains 16 33 gauge needles. The device oscillates. So speed 1 is 66 revolutions per second. Speed 2 is 90 revolutions per second. Speed 3, 105, but speed 4 is 120 revolutions per second. This is unprecedented. This is why we understand that Dermapen delivers superiority due to the power as the original automated microneedling device by comparison to just any microneedling device. This now means that we can create 1,920 fractional vertical puncture channels into the skin per second. Although the needles are solid by comparison to a traditional injection needle, this now means the mechanics of the Dermapen will physically push the ingredient and push the mesotherapy into the skin. What we now see and understand is a flawless distribution method of active agents and complexes, but what we also see numerically that with 1,920 puncture channels per second, Dermapen delivers greater infusion and greater potential by comparison to just single injection technique. So with 1,920 puncture channels per second versus one injection every 5, every 7 seconds, or if you're working with an injector handpiece, it may be 5 injections every 5, every 7 seconds. Irrelevant of this, the mathematics shows that Dermapen with nearly 2,000 puncture channels per second is going to be the superior way to deliver an active substance solution or agent into the skin. So what we now see is a huge area to open up opportunity combining in microneedling, Dermapen 4, but of course with our traditional mesotherapy. I want to state at this point, just because you can put something into the skin doesn't mean that you should. I refer to an American dermatologist who was based in New York at the time, Sultana Arab-Shahi. And Sultana Arab-Shahi introduced microneedling into her practice. And as a leading dermatologist, she knows and understands, as do I, as do you, as active practitioners, that active prescription ingredients, including retinoic acid, Kligman's formula for skin lightening, such as specific steroids, alpha hydroxy acids, aromatic phenolic compounds such as salicylic acid, all have a benefit when applied onto the skin topically. So should that benefit become enhanced if we then use microneedling or Dermapen 4 to deliver that active solution physically into the skin? So Sultana Arab-Shahi began applying many of these common solutions onto her patient's skin and needling them into the skin. But the problem was patients were showing signs of granulomatous reactivity. This got her thinking of, just because you can put something into the skin doesn't mean that you should. There's a risk of granulomas, there's a risk of burning, there's a risk in turn of post-inflammatory hyperpigmentation, infection, and of course, scar tissue. So in 2014, she underwent a clinical where she used a combination of products and ingredients in aesthetic dermatology and then infused them into the skin via microneedling. 70% of patients came back with signs of granulomatous reactivity. And this demonstrated, again, just because you can put something into the skin doesn't mean that you should. So when we assess safety, when we assess efficacy, how do you determine what is suitable for infusion via microneedling with Dermapen 4 by comparison to what is going to be risky behavior? So there's 4 questions that I ask before determining, is this solution safe? 4 questions I ask, is this solution going to be risk-free? 4 questions I ask, is this combination therapy of this product with Dermapen going to deliver a predictable result? The first question I ask the person selling me the product, the first question I check in the training manual on the back of the packaging before putting into someone's skin is, if I know that a kilogram measures weight, if I know that a mile measures distance, what's the system that measures atomic mass or molecular weight? If you don't know the answer to this, this is an issue. This is a red warning light saying don't put this product into a patient's skin. Of course, the answer is a Dalton. And for those of you familiar with injectables, particularly HA fillers, you should be confident with this. However, my second question, how many Daltons do you have? Because if there's too many Daltons and the molecular weight is too big and too heavy, and you force that into the skin, it's going to get stuck. And when it gets stuck, this is where we create granulomatous reactivity. The third question I ask is, the product you have, is it designed for infusion via microneedling, or can this product physically be injected into the skin? Because if it's just designed for topical application only, irrelevant whether it's a famous moisturizer, irrelevant whether an expensive serum, topical is not designed for systemic infusion into the skin. And the final question I ask is the product sterile? Is the product aseptic? And what's the conservation system? Because if it's coming out of a jar, if it's coming out of an unprotected packaging, then this becomes a risk for infection. So if you cannot answer all 4 of these questions confidently, if you don't have the right answer for all 4 of these questions, then don't microneedle this product into your patient's skin. So with this is where the role of DP Dermaceuticals becomes a procedural essential for every Dermapen procedure, never to be substituted. The whole concept of these products is that they are all formulated, they are all molecularly weighted and designed for infusion physically into the skin without risk of reactivity, without risk of granulatomatous reaction, without risk of burning, post-inflammatory hyperpigmentation, and without risk of infection or activating scar tissue. So this all began with a product called Hyla Active, and this was released following the launch of the very first dermapen back in Australia in 2010. The Hyla Active is based on what is called the Hyla Fuse complex, and this features into every single product produced by DP Dermaceuticals designed for infusion into the skin. The Hyla Fuse complex has been developed by the Matrix Biology Institute, the world's largest research and development agency for medical grade hyaluronic acid, and they are in New Jersey in the USA. What they have done is been able to manipulate the molecular weight, or the Daltons, of the hyaluronic acid molecule to such a small size that it now possesses unique opportunities. First, it now means for DP Dermaceuticals, as part of patient ongoing home care, protection management of their skin, this aids as a delivery system to take the actives through and past the skin's natural barrier function. This doesn't occur with a standard cosmetic product, hence why a dermaceutical becomes more advantageous. But it also means that the molecular sizing of the product is so small that when it is infused into the skin with the dermapen device, that it now creates a free, easy movement without risk of granulomas, without risk of burning, and without risk of infection or scar tissue for this. So the molecular weighting is all the way down to just 10 kilodaltons in size. The other advantage of this molecular manipulation means that it serves very similarly to an envelope. We can use the tiny hyaluronic acid molecule to then place other active ingredients, including kojic acid dipalmitate, the stabilized oil-soluble ester of kojic acid, retinaldehyde, a derivative of medical-grade vitamin A that is 400 times stronger than retinol, but also other agents such as copper peptides, into the skin with greater efficacy using the Hyla Fuse hyaluronic acid complex as an effective, safe delivery mechanism. For the DP Dermaceuticals Classic, they are available in a 30 ml aseptic airless pump, in a 50 ml, but now in a 250 ml. For the packaging, the aseptic airless pump now creates a conserving effect and preservation, which means safety. This means that there is no risk of cross-contamination, but an affordable way to deliver mesotherapy as part of your combination therapies with dermapen. Ethyl hexyl glycerin serves as the conserving agent, and in fact it makes the product so pure that you can in fact eat it. So this means that we deliver safety into the skin, and at 10 kilodaltons in a solution that is specifically formulated for infusion, and with the right pH, so there is no risk of burning, but the right complex and overall formulation to ensure no risk of infection, the right delivery mechanism with aseptic packaging. This means that I can answer all of my previous questions confidently to know that DP Dermaceuticals as mesotherapy plus Dermapen 4 create the perfect saturation, the perfect distribution, the perfect infusion, and the perfect updated microneedling procedure. As part of your Dermapen procedure, the further benefits of the Hyla Active as a base medium is that it will facilitate lubrication and a smooth glide across the skin, ensuring ease of movement without drag, without track marks, and delivering a comfortable, efficient procedure. So it becomes not only a facilitating gliding gel, but now creates facilitation, administration, plus the best of mesotherapy as well. So depending on the skin, there are combination therapies of using DP Dermaceuticals Hyla Active plus DP Dermaceuticals Retinol Active also containing the same molecularly manipulated hyaluronic acid delivery mechanism, but with retinaldehyde at 400 times stronger than retinol, but a safe retinoid delivery without the risk, the burn, and the irritation of retinoic acid, particularly suitable for scarred, aged, and stretch marked skins. There is also the combination therapy of DP Dermaceuticals Hyalactive plus DP Dermaceuticals Bright Light. And so for protocols, you just simply blend the Hyalactive with your choice of other DP Dermaceuticals to customize. The Bright Light uses a specialized pH-balanced kojic acid dipalmitate. This means that it is not pure kojic acid. There is no stability issue or reactivity. It means that it delivers in the perfect pH and the perfect formulation, particularly for hyperpigmentation. For treatment of vascular imbalances, there is Hyalactive blended 50-50 with the antioxidant cocktail, a blend of molecularly weighted hyaluronic acid to deliver niacinamide and copper peptides. But for those patients with acne, there is the DP Dermaceuticals Classic Clearer Lotion, which delivers a special oligopeptide 10 that is anti-P. acnes bacteria, but also anti-Staphylococcus epidermis. So our protocols for the classic DP Dermaceuticals is to simply mix and blend your Hyalactive as 50% of your gliding mechanism, as 50% of your topical mesotherapy, either in with Clearer Lotion for treatment of acne, in with Bright Light for any form of hyperpigmentation, including melasma, treatment with retinol active with active retinaldehyde for scarring, for anti-aging, and also for stretch marks, or for treatment of rosacea, telangiectasia, the antioxidant cocktail. So these serve as affordable ways to distribute an affordable mesotherapy for the average patient, delivering safety, efficacy, the right molecular weight, the right design, the right formulation, the right pH, and the right system to guarantee that there is absolutely no risk. The other option, and this serves as a premium procedure for Dermapen, is to use the new MG collection. The MG collection features 5 mils, and these are sterile glass vials which have a nipple end which can easily be applied for topical application. However, these can also be drawn up with a Luer-Lock syringe so that you can mix and blend your solutions together, creating a perfect and effortless mesotherapy procedure that only requires Dermapen for infusion. If you choose, you can use traditional administration of mesotherapy with a needle, but otherwise, Dermapen now creates the perfect distribution point for you. The new MG collection will be available in India soon, particularly once we are through these moments and challenging instability, but it will feature an unprecedented HA35 hyaluronic acid and an HA35 plus. All the products feature a specialized calcium phosphate or calphosome delivery system to ensure even better penetration of the actives, which feature anti-inflammatories, including Centella asiatica, but also features telomere technology so that we can work and enhance on a DNA level for skin quality and skin functionality. There are specialized MG solutions also for pigmentation. The product is called MGBL. For acne, the product is called MGCLR, but also for anti-aging, scars, stretch marks, and rosacea, and this is called MGRAS. So with this, irrelevant whether you're using your traditional technique, combining in and blending onto the skin 50-50, your Hyalactive plus your choice of other DP Dermaceuticals, or whether you are using the brand new MG collection and using traditional mesotherapy method first, and then creating infusion and distribution with your Dermapen, simply apply the solution onto the skin, your desired blend, and then use Dermapen at full speed. Pick your desired depth, and then using a striking technique, this can easily be administered into the skin. If you imagine the flag of the United Kingdom, administration is vertical stripes, followed by horizontal, diagonal 1, diagonal 2. We never use circular techniques with Dermapen, it will rip the skin. How do I know exactly where I'm working within the skin? Depends on the indication that you're wanting to treat to enable direct cell stimulation. I treat visually as opposed to mathematically. If there is no blood and no color change of the skin, that's your sign that you're working on stratum corneum. If there's no blood, but the skin is visually pink, you're working granulosum epidermis. If there is no blood, but the skin is red, you're working basal spinosum epidermis. If there is consistent pinpoint blood, then you are working in papillary down to reticular dermis. And then there, if mild to moderate blood coming out, this means that your needles are now working down to the hypodermis. So you simply turn your needles up or turn your needles down as required based on the indication that you're treating. Remember, particularly for pigmentation, remember particularly for treatment of acne, your needles only need to be superficial into the epidermis. But on the other hand, particularly for scar treatments, just because your pen does go down to 3 millimeters does not mean every scar that you treat necessarily is going to require 3 millimeters. So working safely and working effectively, Dermapen now promotes the best of autologous regeneration, regulatory growth factors, angiogenesis, collagen deposition, and the mechanical breakdown of existing scar tissue. But now with the combination therapy of DP dermaceuticals, we have biomimetic delivery systems with high diffuse and calcium phosphate calphosome technology, which guarantees comfortable administration of PRP. This can also be combined in its comfortable administration of mesotherapy, but comfortable administration even for PRP without injection, for nanofat without injection, using your DP dermaceuticals as facilitators, as a procedural glide, but as the ultimate combination therapy of microneedling, autologous regeneration, and DP dermaceuticals, safe, effective, predictable infusion, ensuring health of your patient's skin and acceleration of their results. That concludes the formal part of the webinar. I'm just going to go through some of the questions that we have. So I've been asked, firstly, what does fractional particularly refer to with microneedling? So with Dermapen, it is a non-ablative procedure. This means that the epidermis remains intact. So as the needles oscillate over the skin, it will deliver 1,920 microchannels per second. But those microchannels are separated. So it means that the epidermis remains intact and the whole tissue is not ablated. So it means that we're not targeting 100% of the skin, we're targeting about 70 to 80% of the skin, so the surrounding healthy tissue can enable a faster, effective healing. So this fractionality means that there is faster healing. It means that there is no bruising. There should be no scabbing, there should be no grazing or track marks or even flaking of the skin following the physical procedure. The next question relates into what I've just answered. So at top speed, your Dermapen is 120 revolutions per second. Multiply 120 by the number of needles in the needle cartridge, which is 16 lots of 33 gauge needles. So that means it's an unprecedented 1,920 puncture channels per second. So for those of you who weren't in attendance for some of my previous mini webinars, what constitutes the difference between Dermapen by comparison to just any old microneedling device is the fact that the power of this motor can sustain the 16 needles in this cartridge so fast and so effortlessly that we now deliver an unprecedented nearly 2,000 puncture channels per second. That not only facilitates fractional rejuvenation, growth factors, mechanical breakdown of scar tissue, collagen and angiogenesis, but now also facilitates the infusion of your procedural actives with DP dermaceuticals. That concludes my questions and answers, but it also concludes the formal part of today's mini webinar. I look very much forward to catching up with you same time next week on Tuesday, where I'm going to be covering the topic of Dermapen World Anti-Contamination Management System, how to deliver a sterile and safe, effective procedure for every patient, every time. I'm Dr. Andrew R. Christie. I'm going to sign off now and hand you back to Mr. Umang Bambri from Dermapen World India. Do enjoy a great week, and I look forward to catching up with you next week. Thank you.
Thank you, Dr. Andrew. Indeed, it's always so exciting to hearing you. Thank you, our audience, as well for your participation for today's webinar. Hope it adds to a lot of action into your practice. We also look forward to joining you for our Global KOL webinar tomorrow at 9:30 p.m. India Standard Time, which is also done by globally renowned speakers, Dr. Parhaden from Sweden, Dr. Shino Bay from Florida, and Dr. Gabriela from Spain. Do sign up if not done already. Our web series topic for the next session, as Andrew has already shared, is going to be how to deliver sterile and safe aesthetic procedures with Dermapen 4 ACM. Thanks a lot. Thank you.